For years, Medicare Advantage has been this incredible growth story in American healthcare, just nonstop expansion. But that story, it's changing. And it's changing fast. We're now seeing a major shift, a contraction, really, and it's going to affect millions of people. To really get the scale of this, just wrap your head around this number 54%. That's how many eligible Medicare beneficiaries are now in a private Medicare Advantage plan. We're talking more than half. That's over 34 million Americans. It's huge. So, what happens when a market that massive suddenly slams on the brakes? After all these years of more and more choices with new plans popping up everywhere, that era of explosive growth seems to be over. A new, much more turbulent reality is setting in. Okay, so let's get into it. Here's how we're going to break this down. First, we'll look at the shifting landscape itself. Then, we'll dig into the big squeeze, all the pressures causing this change. We'll see how the market is shaking up because of it. And finally, we'll get to what really matters, the millions of people who are now facing some pretty tough choices. All right, first up, a shifting landscape. To really understand what's happening right now, we've got to look at just how fast this market grew and why 2026 is suddenly such a dramatic turning point. I mean, this trend line says it all, doesn't it? Just a couple years ago, in 2022, the average person could choose from about 31 different plans. That number rocketed up, peaking in 2024 at a whopping 36 plans. But then look, for 2026, that choice is shrinking back down to 32. It really does feel like the party's winding down. So why is this happening? Well, that takes us to our second section, the big squeeze. This sudden pullback isn't happening in a vacuum. It's more like a perfect storm of financial and regulatory pressures that's forcing these insurance companies to completely rethink their game plan. Honestly, insurers are getting hit from every direction. You've got rising Medicare spending, especially on pricey prescription drugs. At the exact same time, the government is bringing in stricter payment models and tougher quality ratings, making it a lot harder to get those bonus payments. Then you throw in some market instability from the Inflation Reduction Act and the insane cost of new weight loss drugs. Well, it's the perfect recipe for squeezed profits. And let me tell you, this regulatory pressure has real teeth. This isn't just a suggestion. This is a direct quote from a sanction letter that the Centers for Medicare and Medicaid Services, that's CMS, sent to Elevance Health, one of the biggest insurers in the country. And when they say suspension of enrollment, they absolutely mean it. This move is called an intermediate sanction, and it's one of the most powerful tools the regulators have. Basically, it puts a company in a timeout. They are literally blocked from signing up any new members until they get their act together and fix the problems. It's a crystal clear signal that the government is cracking down hard. So, with all this pressure building, how is the industry actually reacting? Well, that leads us right to part 3, the market shakeup. Because faced with all these challenges, insurers are not just sitting still. They're making some pretty big moves. And this just shows you the scale of the retreat. Look at these numbers for 2026. We're talking about the biggest names in the business: UnitedHealthcare, Humana, Elevance, CVS, and they are all leaving way more counties than they're entering. I mean, UnitedHealthcare alone is getting out of 225 counties. That's a net loss of over 200 markets for them. This is not just trimming the hedges. This is a major strategic pullback. So when you add it all up, what you get is a market-wide contraction. Across the whole country, the total number of plans to choose from has dropped by 9% in a single year. That's 346 fewer plans on the market. It confirms this is a really broad trend, not just a few companies making changes. And that brings us to our last and, honestly, our most important section. Millions face a choice. Because behind all of these numbers and market statistics are real people. People whose healthcare is being turned upside down, forcing them to figure out a landscape that's suddenly a lot more complicated. This is the number that really hits home. 2.6 million. That is how many people were told that their Medicare Advantage plan was being canceled for 2026. To put that in perspective, that's more than double the number of people who got that same news the year before. The human scale of this is just immense. So what happens to all these people? Well, let's break it down. Now, the good news is that the vast majority, almost 69%, do have other options. They can pick another plan from their same company or switch to a totally different one. But here's where it gets tricky. For almost 30% of them, their only choice is to find a brand new insurance company. And for a small but really significant group, about 1.1%, that's almost 30,000 people, there are simply no other Medicare Advantage plans available in their county. At all.
And of course, this impact isn't spread out evenly. People in rural areas are getting hit the hardest, by far. And it's interesting, while the big national companies are pulling back, it's actually the customers of smaller regional insurers who make up nearly half of everyone losing their plan. So if you live in a state with a lot of rural areas, like a Vermont or Wyoming, you're seeing the biggest share of these withdrawals.
So for those people whose plans are being cut, there is a path forward. The most direct route is just to enroll in a different Medicare Advantage plan, if one's available. But, and this is so important, this is also a key moment where they can switch back to traditional government-run Medicare. If they go that route, they'll need to get a separate Part D drug plan, and they'll also get a special window of opportunity to buy a Medigap policy to help with out-of-pocket costs, and they can't be denied for pre-existing conditions.
Okay, so the big takeaway here is this. The Wild West days of Medicare Advantage, this sort of grow at all costs era, they're over. The market is maturing, and all this turbulence, which is definitely disruptive for millions, is really part of a larger shift. The industry is trying to find a more stable, a more sustainable way to do business now that the economic reality has changed. And that leaves us with a huge question for the future of American healthcare. Is this painful contraction just a temporary correction, a cooling off period after years of being overheated? Or are we actually watching the beginning of a new, more limited normal for the 34 million people who rely on Medicare Advantage?